I'm ready
Okay.
if you are.
Alright. My name is, should I look at the camera?
No, it
Oh,
doesn't
okay.
matter.
All
You
right.
can look at me.
Alright, my name is Jason Edwards. I'm a physical therapist. I'm director of rehab out here at St. Bernard's Villa. We've been out here for about 3 years. Prior to that, I worked in the hospital for about 6 years.
Okay.
So I've been out of school since 2009. Graduated with my master's degree from ASU
Okay.
and a bachelor in biology from ASU.
You did? Okay, cool.
Yeah, so.
Alright, you just answered a few of my questions.
Well, good.
But that's okay. So, the first question is, why did you choose this profession?
Well, I'd always been interested in some type of medicine, whether it be sports medicine or something like that. I was actually pre-med for the first 3 years of school, and I was just sitting through, I think it was like genetics or physical chemistry or one of the courses, like my senior year, and I just didn't want to do it. I just wasn't interested in it, and I was like, I just don't want to do this. And actually walked out of the class, and when I walked out, they were having like a job fair type thing outside of the class, and they had a physical therapy booth set up. And at that booth was this person named Michelle Young, who's actually one of my very good dear friends now. She's a colleague of mine. She works at St. Bernard's in the hospital. She was at the booth, and she just started talking to me about PT, and I knew a little bit about PT prior to that. I didn't know exactly what all it entailed, but she invited me to like one of the student activity events that they threw in the department at that time, and I went to that and met some people, and somehow they talked me into it and liked it ever since.
Yeah.
So
Here you go.
it kind of I've always had an interest in anatomy, physiology, and physics, along with sports and stuff like that. So it kind of encompassed all that stuff together.
Mm-hmm.
So
I'm kind of the same way. I started off pre-med,
did you?
but only for a year, and I hated my life.
Yep.
I hated every bit of it, and I'd always said, I'm going to be a doctor.
Yep.
So pre-med, and then I hated it, and I was just kind of like exploring my options, and physical therapy came up, and I was like, that's actually something that I love.
Yeah.
And I looked at like the extra science degree plan,
Yep.
and I was like, that's all stuff that I actually care about and I want to know about.
Yep.
So I changed, and it was also like the patient care side of it. You don't really get that when you're a doctor. So and I wanted that.
You get a lot of one-on-one valuable time.
Yeah.
A lot of our patients, they put a lot of trust on it. They confide in us with a lot of stuff that they probably don't even confide in with their physicians.
Yeah.
Which, that's something we take a lot of pride in. And, being a PT, you also get quite a bit of autonomy. So you have a lot of independence that I think a lot of people don't realize that you do have. You get to make a lot of clinical decisions for that patient that really helps them out in the long run.
Yeah.
So I apologize for having to put that on silence. But yeah, I think you made a good choice. I mean, it's a great profession. Yeah. It's growing. It's there's going to continue to be with all healthcare professions as the years go by. Medicare and all the other insurance companies are gradually going to try to restrict things that we do. So it's always going to be kind of a political battle, but
that was one thing that I kind of talked to a physical therapist before I changed. And that's what he told me that was like the only skeptical thing about it. But
that's going to be every profession.
Right.
It's not just specific to PT.
Yes.
I mean, physicians are getting capped. Basically, you just have to prove your worth to the company. And that comes from documentation. So that's really the negative part of it of being a PT is you spend probably at least half of your time documenting.
Yeah.
And I'm in here more than I'm out there, which is unfortunate. But
whenever I was shadowing the students, they were always like, the worst part is paperwork.
Yep.
It's so much.
Yep. It all depends on so we see about 80% Medicare. And with Medicare, what they really what they've incorporated is basically you have a patient, you've begun this plan of care with them, so this episode of care, and every 10th visit or so, you have to basically reassess everything that you've on the patient's progress. You have to redo everything that you did from day one.
Mm-hmm.
So we have different tests that we use, and all these tests look at different things, whether it be their gait or their balance, their strength, whatever. And we use those to kind of come up with what are called G codes, and they use these functional limitation percentages. And so you use these tests to calculate that. Well, then every 10th visit you have to redo all that and come up with new codes and all that. And so when you have 80% Medicare, you're doing those tests pretty much every day and having to do these big detailed reports on them. So that's a negative part of it, but the positives very much outweigh the negative. So.
Good. My next question is, how long have you been working in this field, which you already answered.
Mm-hmm.
So what advice would you give to someone pursuing this profession?
Well, one is don't let, like I just kind of gave you some negative impressions of the field. Don't let that skew your motivation to become a therapist.
Yeah.
Because like I said, the positives far outweigh the negatives. When school's tough, but it's very doable as long as you stay focused and stay committed to what you're doing. Another piece of advice that I would give is probably even before you start school, and even once you go through the first year or two, you might have an idea of what you want to do. Like when I first started, I thought I was going to be mostly sports.
Yeah, that's my next question.
Turns out I really enjoy treating like geriatric patients, and I really love treating neurological type things.
That was my favorite that I've shadowed.
I love neurological. As devastating as some of the issues can be, whether it be something progressive like Parkinson's disease, ALS, MS, something like that, or a sudden thing like a stroke or a spinal cord injury, as sad as those are, they're very interesting to work with because you can really make a difference in their life, and it's a lifelong type thing. So a lot of the patients I've had them for 2 or 3 years, maybe off and on, but they come back every few months for kind of a tune-up type session. So that's a good thing. It's good that they trust us that much to let us continue with that aspect of their life. So I wouldn't get too set on one setting. And don't be scared to kind of look at multiple things. With your rotations, as hard as it might be, especially if you're focused in on orthopedic type thing, don't try to get all your clinicals in orthopedic, which they won't allow you to.
Do you get to pick your?
You get to a degree, you do. So they'll do like or at least when I was in school, they'll do like a lottery system to where you draw numbers.
Okay.
And so whoever got number 1 got the first pick to what clinical they wanted to, and then for your second one, you go in reverse order, so everybody gets kind of the same chance of picking their clinical. So, kind of pick something maybe that's out of your comfort zone a little bit so you can get some experience with that. And Christy Vincent, who does the kind of the clinical assignment for ASU, she does a good job of making sure you're in a good location with good clinical instructors, and they're very supportive. So
good.
So use her as your resource in school.
Good to know. Yeah. Good to know. Yeah, I've always wanted to do, or said that I want to do like ortho or peds, and then last summer I did a ton of shadowing, and I loved peds, but I did a neurorestorative clinic, and I did the pediatric side and the adult side.
Oh, cool.
And on the pediatric side, it was all just like injuries, like car wrecks, dirt bike wrecks, just crazy stuff like that. And it just, the first day that I went, I left and I called my mom and I was like, I cannot go back there. It is so sad. It broke my heart. But I went back and then I just fell in love with it. And so now, I'm really interested in neuro.
Oh, good.
So,
well, then we need more neurotherapists.
Yeah, I'm super interested in it. And then I did an ortho clinic and I did not like it at all. Because it's just the same thing over and over and
It's
over.
very repetitive, very protocol based. I mean, we do see our fair share of orthopedic stuff. I mean, this morning I started a patient that had a total knee surgery or total knee replacement 2 days ago. I got another one this afternoon that's total hip replacement. So we get our fair share of those. I see a lot of back pain, neck pain, you know. But we do our fair share of certain manipulation techniques and stuff like that. So we do like those, but my favorite is definitely neurological type stuff. And I also enjoy vestibular type stuff, which is inner ear dysfunction. Usually you have patients that have vertigo and a lot of balance loss, which is the patient that Anna must out there, and that's some of the stuff he's got going on. So it's very interesting because it's pretty complex. So you're constantly having to think about what you're doing. I enjoy that.
Yeah, and when I saw all the neuro patients, they might have had the same injury, but they weren't the same. They were all completely different, and I like that.
Yep, that's very interesting.
Yeah. Okay. Was it difficult finding a job once you graduated school?
No, it wasn't. Not for me, and the reason I say that is because before I went to PT school, I was actually an aide at the hospital for about 3 years, and so I had some good connections. My boss now, Todd Burton, who's the director over there, he's above me out here, but he's a really good friend of mine now. But back when I was an aide, I kind of made a connection with him and told him, I've 3 years, I wouldn't mind working for Therapy Providers of Arkansas, and kind of stayed in touch with them through that period, and they had a job waiting on me when I got out of school. Yeah, so it's been nice and kind of just been able to work up the last 8 or 9 years, and it's worked out well.
Yeah.
I think, with having a school here, it's a good thing, but it's also does tend to maybe saturate the market somewhat with jobs in this area, but there's always something.
I'm from Central Arkansas.
Oh, good. Where?
So I'm from Bauxite.
Okay, yeah. I'm from Pine Bluff. So,
okay.
So I'm down from that area too. Yeah.
Whenever I tell people that from here, they're like, "Do what?"
We used to play Bauxite quite a bit in baseball. So I went to Wassa Chapel.
Yes, I played them when I was in high school.
Did you?
Yeah, basketball.
Good deal.
Yeah, I don't think we still play them, but we definitely did when I was there.
Yeah.
Okay. So my next question was, did you work in multiple settings before you came here to the outpatient clinic? What you said you worked in the hospital.
So I worked in acute care. Now in acute care, I did work in several different areas. So my main thing was I was the neurological PT. So anybody that came in that had a stroke, or some other type of neurological injury, or if they were in and had some type of exacerbation with their Parkinson's or their MS, I was usually the therapist at the home. Also, with Michelle, we were kind of co-team leaders or whatever for the orthopedic team. So we saw all the elective surgeries, whether it be knees and hips, whether it be, they had spinal surgery or neck surgery, and then any of the trauma cases.
Yeah, so you saw everything.
A little bit of everything. Some stuff in intensive care. That's not really my favorite area to be in, but I did have quite a bit of some experience down there. And I work on a weekend rotation once every 3 months or so at the hospital, so I still get my feel of intensive care and all that. So, but several different settings before being out here.
Whenever you did when you were in school and you did your clinical rotations, did you get to do all different types of settings? Did you do home health and all that kind of stuff?
I've never done home health, not as a student, and I've seen one home health patient since I've been out of school, and that was kind of just out of necessity. Both our home health therapists were sick. Something else had gone on, and they just called me, and I was like, I'll do it one time.
That doesn't seem like something that I want to do.
It does take a special person, I think, to be able to do that. I don't feel like I'm creative enough to go in someone's house and figure out things for them to do. That's just not my area. We have some really good therapists that do that. And it definitely has its place in the whole realm of PT.
Yeah.
What was the question? I'm sorry.
Oh.
Oh, and clinical rotation.
Yeah.
Yes. So my first one I did was a outpatient orthopedic clinic in Fort Smith. It was just kind of general back pain stuff. It was a good first clinical because it wasn't just real busy. So I got to really kind of take my time and do stuff. And I figured out, how to do documentation and all that. So it did allow for more time to do that kind of stuff. I also got to see them do what's called work conditioning, and they do functional capacity evaluation. So you have patients that are like on workers' comp or something, right? And for them to receive those benefits and for them to be able to return to work, they have to participate in these different evaluations.
I saw some of that this summer.
Not my thing. It's not something, because they're usually like 4-hour tests, and you basically sit there and watch somebody do different things for 4 hours.
Pick up boxes and stuff, yes.
But it was a good experience to be able to see that. My second one was an acute care rotation in North Little Rock at the Baptist Hospital there. It was a good rotation. It was a little 5-week program, and got to do a lot of wound care, which PTs don't really do as much of in Arkansas anymore. But when I was in school, and even before that at the hospital, PTs handled basically all the complex wound care, but reimbursement's gone down for that quite a bit. So a lot of us are trying to get out. We're just trying to get out of that area as much as possible. My third rotation. I was at another sports medicine clinic in North Little Rock. It was a good one. It was called Central Arkansas Sports Medicine. It's something different now. He partnered with another therapist a few years ago, but it was a good one. It was a lot of athletes and stuff like that. My fourth one actually got to work with the Cardinals in St. Louis. So my CI was a therapist for them. So I got to go up there for, it was a 10-week clinical, and got to do a lot of training with a lot of players up there.
That'd be really neat.
It was a good experience. It was great. In fact, I got these are from some of the players that I treated up there. So it was pretty cool. And then my last one was a neuro rotation at Baptist Rehab Institute in Little Rock. So they're probably one of the top of the nation. A lot of different things. So at that one, I got to see a lot of spinal cord injury, a lot of MS, Parkinson's. So it kind of, we had a lot of, when I was in school, we got a lot of neuro education. That was probably the biggest thing we got. And so that rotation really helped kind of put those skills that we learned into use. And it's kind of helped me now that we're out here doing what we're doing out here. So it's pretty cool.
Exciting. So, I like to hear that.
Yeah. That's a good rotation. I'd recommend that one too if you get a chance.
I'm going to try to get some type of neuro somewhere.
Good.
Yes. So what do you like best about working in the outpatient?
In this setting?
Yes.
I guess the autonomy of it. Like we're the only ones out here, so we're making a lot of these decisions, and I like doing that. And we do communicate well with the physicians and a lot of the physicians that refer to us trust us quite a bit. I think. I like one. It's a very nice place to work. It's very, state of the art.
Yeah, it's nice.
We see a lot of aquatics. So that's another thing that I really enjoy is doing some aquatic therapy.
Yeah.
The flexibility of it, it's nice, but sometimes it is fairly rigid because you're stuck with appointment time. So, if you need to leave early, a lot of times you can't because you might have a 4 o'clock patient or something like that, and that's okay.
So you don't get to pick and choose where you put your patients?
You can, you can. As long as you know that something's coming up.
Yeah.
Now, if something like tomorrow